Dialysis is a modern medical marvel. It is a powerful, life-sustaining treatment that does the work of failing kidneys. For millions, it represents a bridge to a longer, fuller life. We often focus on the hours spent connected to the machine, the intricate process of cleaning the blood. But what happens in the moments, hours, days after the machine is turned off? This is the unseen second half of the treatment, just as critical as the dialysis itself. Proper post-dialysis care is not just a follow-up task, it is an essential part of the therapeutic process. Think of it like landing an airplane. The flight, the dialysis session, is incredibly complex. Similarly, post-dialysis care is about ensuring a safe and smooth landing for the body. The body has just undergone a major fluid and electrolyte shift. Blood pressure can fluctuate, feelings of fatigue or lightheadedness are common. It requires a partnership between the healthcare team, the patient, and their caregivers. This structured care plan transforms a potentially risky transition into a routine, manageable part of the patient's health journey. Ultimately, mastering post-dialysis care is about improving a patient's quality of life. Disclaimer: this video is intended for educational purposes only and must never be used as medical advice. Please consult your doctor about any personal health concerns. The process of disconnecting a patient from the dialysis machine marks a critical transition. The first step is impeccable hand hygiene. Don a fresh pair of gloves, the cornerstone of infection prevention. Patient in a comfortable, semi-reclined position. Keep the environment calm, clean and free from unnecessary clutter. Prepare supplies, sterile gauze, tape, and pressure dressings. Stop the blood flow. Turn off the machine's blood pump. Clamp the lines per protocol. Remove one needle at a time. Withdraw smoothly at the same insertion angle. Immediately place sterile gauze and apply firm, direct pressure. Hold pressure for about 10 to 15 minutes. Time varies with access maturity. Do not peek at the site during pressure. This is a moment for calm reassurance. Chat with the patient. Ask how they are feeling. Reinforce post-care instructions with a printed handout. Once bleeding stops, apply a clean, sterile dressing, a protective barrier. Check circulation, not too tight. Avoid impeding access blood flow. Instruct the patient to keep the dressing on for several hours. Check vital signs, especially blood pressure. Check in a standing position and/or a seated position as appropriate. Confirm the patient is ready to safely transition home with their lifeline protected. A precise, stepwise disconnection. Hygiene, clamp, remove, pressure, dress, check vitals, ensures a safe finish. Once the needles are out and the dressing is on, the period of careful observation begins. This is not passive. It is an active assessment to catch issues early. Visually inspect the dressing for strike-through bleeding. Gently palpate around the dressing to check the thrill. A strong thrill indicates healthy access. Absence or a significant change in the thrill is a red flag needing immediate attention. Beyond the access, check the patient's overall condition. Fatigue, dizziness, nausea, headache, cramps. Ask, do you feel dizzy or woozy? Are you nauseous? Any headache or cramps? Observe skin color and temperature for paleness, clamminess, or excessive sweating. Observation should continue for at least 15 to 30 minutes before discharge. Encourage the patient to sit up slowly, then stand with assistance to avoid orthostatic hypotension. Rushing can trigger orthostatic hypotension. Be ready to steady the patient. Before the patient walks out the door, perform a final check of the dressing and their stability. Provide written aftercare instructions and a reminder of whom to call if problems develop. Ensure they leave safe, stable, and prepared for the hours ahead. Brief pause. If you enjoy this video, please take a second to like and subscribe. Also, check the description below for links to additional useful resources. Effective patient education is not a lecture. It is a conversation. It transforms the patient from a passive recipient into an active, knowledgeable partner. Break down complex information into simple, actionable steps. Instead of saying watch for infection, explain what that actually looks like: redness, swelling, warmth, drainage. A powerful tool is the teach-back method. Ask, can you show me how you'll feel for the buzz in your arm when you get home? This confirms understanding in a way, do you have any questions? Cannot. Tailor materials to the patient's needs, large print, captions, or short videos as required. Include caregivers when appropriate and adapt to literacy, hearing, or cognitive needs. If the patient struggles, re-explain using a different aid. Practice until confident. Reinforce education at every session and save complex details for future visits. Provide simple, written materials with pictures and emergency contact numbers. This gives the patient a reference they can turn to between sessions. Hands-on skills practice, AV fistula, graft, and catheter disconnection drills. Reinforce technique and confidence. Use stop clock timing on trainers to practice proper hold times and hemostasis. By investing time in thorough, compassionate, and continuous education, we build a patient's confidence and competence. Make the patient the most important member of the care team. Empowering patients means giving clear understanding of what is normal and what is a red flag. These warning signs are the body's way of signaling something is wrong. Any bleeding from the site after leaving the clinic is an emergency. Apply firm, direct pressure and call the clinic or emergency services. A sudden loss of the thrill or pulse in the access arm is critical. Seek urgent evaluation. Look for increasing redness, swelling, warmth, or pus-like drainage. A fever or chills may signal a systemic infection. Call your provider immediately. Extreme weakness, severe dizziness, or fainting require prompt assessment. Sudden shortness of breath, chest pain, or a rapid, irregular heartbeat. Call 911. It's far better to call for advice and be told everything is fine than to ignore a potentially serious problem. Also explain the green lights. Clean, dry dressing, no new bleeding, a strong thrill, and gradual improvement. This clarity reduces anxiety and helps patients confidently manage their health between clinic visits. In the world of healthcare, what isn't documented didn't happen. This is especially true for post-dialysis care. Meticulous, real-time documentation is not just paperwork. It is a vital tool for communication and quality improvement. Every step must be recorded: pump stopped, final vitals, time needles removed, duration pressure held. Record the time the needles were removed. Document how long pressure was held. Note the condition of the access site once hemostasis is achieved. Record patient complaints verbatim: dizziness, cramping, headache, and actions taken. Document interventions: assisted back to chair, provided fluids, and time to resolution. Good notes are a communication bridge for the next shift and for other clinicians. When a patient arrives in the ER, last dialysis notes can provide crucial clues: low BP, bleeding difficulty, or recent access issues. Consistent documentation lets clinics spot trends, multiple hypotensive episodes or rising infections, and drive quality improvement. Data-driven retraining can turn reactive care into proactive prevention. Write it down accurately. It elevates care and can save vascular access and lives. Dealing with a chronic illness like kidney failure is as much an emotional and psychological journey as it is a physical one. The hours after a dialysis session can be a particularly vulnerable time. Active listening is the cornerstone of supportive communication. It makes perfect sense that you would feel frustrated by that. You did a great job holding still. Is there anything I can do to make you more comfortable? Trust is built through consistency, honesty, and compassion over time. Celebrate small victories and remember personal details. They matter. Emotional support is an integrated part of holistic post-dialysis care. It helps patients feel safer and more resilient. A steady, calming presence during a challenging time improves adherence and outcomes. What you eat and drink between treatments directly affects how you feel and the success of the next session. After a session, patients often feel thirsty. Quench thirst with small sips, sugar-free candy, or frozen lemon wedges. Emphasize nutrition. Limit potassium, sodium, and phosphorus. Limit sodium. Avoid canned soups and processed foods. Flavor with herbs and spices instead. Reduce high-potassium foods like bananas and potatoes. Swap to berries, cauliflower, or white rice. Phosphorus is high in dairy and certain foods. Dietitians can recommend phosphate binders taken with meals. Take prescribed binders with meals to reduce absorption. Monitor weight daily. Weigh at the same time after using the restroom and before eating. Keep a simple log and bring it to each dialysis session to help set fluid removal goals. Encourage light, regular activity on non-dialysis days to boost energy and mood. Protect the access arm. No BP cuffs, no tight clothing, and avoid heavy lifting with that arm. These simple habits, diet, fluid control, daily weight, and gentle activity, make each dialysis cycle smoother and improve overall health. Simply telling a patient what to do is rarely enough to inspire lasting change. Motivational interviewing is a collaborative style that helps patients find their own reasons to change. Ask open-ended questions. What are some challenges you face with limiting fluids? Use reflective listening. It sounds like the constant thirst is the biggest barrier and it feels overwhelming. Explore how daily habits fit a patient's deeper goals. More energy to play with grandchildren, for example. Brainstorm small, manageable steps. Measure a daily fluid allowance in a pitcher each morning. Express confidence and support. Build self-efficacy with tiny, achievable goals. Motivational interviewing turns self-care into a meaningful, achievable journey. Thank you so much for your precious time. If you enjoy this video, please take a second to like, subscribe, and share. Also, check the description below for links to additional useful resources.